Good afternoon, everyone, and welcome. Today with me, I have Julie Hibben, and she is the project director for the Iowa Overdose Data to Action project. So welcome, Julie. Thanks for joining me.
Thank you. Thanks for having me.
So you are in Iowa. So would you, they have a different structure as far as prevention goes, like from folks in Missouri, probably Kansas and Iowa as well. So could you explain briefly the prevention structure in Iowa?
Sure, I would be happy to. So Iowa is, I think, a little maybe unique. There are some states that focus mostly on funding coalitions solely, but we fund a variety of different contractors. We have, I think right now, about 6 or 7 different grant opportunities that we administer through our Bureau of Substance Abuse in the Iowa Department of Public Health. And we fund everyone from school districts to coalitions, mentoring programs, and then we also fund a prevention agency or organization system in our state. And those agencies serve all 99 counties with primary prevention services through our block grant. But we have discretionary grants, we have state funds that do fund coalitions as well. And that's something certainly we believe strongly, and you have to have a strong coalition to do good prevention work.
Absolutely. So before we get into the coaching program that y'all developed, could you give us a little bit of background on how you identified this as a need in your state?
Sure. So in 2009, Iowa received a Strategic Prevention Framework State Incentive Grant, or SPFSIG. So those of you who've been around in prevention a while probably have heard of that grant at some point. And that was really the first grant that we received that really made the strategic prevention framework process more intentional. We certainly had talked about SPIF a lot in the past, but to really be able to focus our local subrecipients on just doing the SPIF was going to be a different process. We knew likely that the folks we funded in that grant were going to need a lot of support because it was really changing how they looked at prevention. So we decided, another colleague of mine, a colleague and myself, we met with a couple of different states to talk about what they were doing to support their subrecipients when it came to SPIF work. So we met with the state of Kentucky, the state of Florida, and then the state of South Carolina. And we heard just a variety of different things. Some had a training team in place. Some had just a good, solid training system in place. And we're doing, TA and training through a specific entity. And then the state of South Carolina actually had a coaching system in place. And that was really intriguing to us. So we took kind of pieces and parts of every system that we heard about and created our own system in Iowa. So coaching started after that. We worked with a professional coach, and we still work with her. Her name's Deidre Danaher. She's based out of Jackson, Mississippi. And she gave us some ideas of what we could do to create this coaching system. So we ended up creating a request for proposal process, and we put it out, and we got a team of coaches that we funded. And they really did help us build this infrastructure, and it's changed over the years. But the great thing about it is we've been able to continue to support it through a number of different grants. It's, like I've said, it's kind of morphed over the years, but the foundation is still the same. Coaching isn't you may hear coaching that term used a lot, but at least through our program, we're really wanting to focus on coaching skills. So it isn't a training program. It's not a technical assistance program. Our coaches don't give TA on our grants or projects, but they really work with anybody who's funded in our bureau to help them solve problems, to come up with solutions, to set goals. And it really started because of the SPIF, but it's become broader than that. So that's really the foundation that we've started from. We've been able to actually keep a good handful of those coaches we initially started with, which is great. We're so excited that we've been able to maintain that infrastructure. And now we're funding it through our Overdose Data to Action grant and then some state funds as well.
And how many years has this been in place?
It has been probably around 10 years that we've had the program going. And I can see probably we're in the process right now discussing expansion of it because, like I said, we've had these same coaches with us for 10 years, and probably at some point they're going to be moving on in their professional careers to other things. This is a very, very part-time portion of their jobs. Many of them are either coalition directors or agency executive directors. One now works for our department full time. So we know that their time with us is probably limited. We're really lucky that we've been able to keep them this whole time. So we are looking at expansion. What that's going to look like, we'll probably know more over this next year, but we're working with our professional coach in Mississippi to kind of figure out some of those next steps.
So what does like the coaching model look like? Is it like one-on-one? How much time do they spend together a week? Some of those kind of details.
Good questions. So if somebody wants coaching and is a current contractor of us, whether they're in a coalition, a prevention agency, a school district, we have an online application that they fill out. And it just gives us a little bit of detail about what they're wanting, the frequency of coaching they're wanting, the topics that they really want to focus in on. And then we also have some agreements that they have to adhere to if they want to be coached. Things like making sure that their agency is supportive of coaching, because some agencies don't really understand it. We tried really hard to be educating people about what coaching is, but we need agency support, that coaching isn't replacing supervision. Like if someone's having a problem employee, you can't just think that coaching is going to solve those issues. We don't deal with internal agency issues. We want coaches or anybody who's coached to make sure that they're participating in coaching through our Zoom web conferencing system, which is what our department supports, that they have a webcam and that they're trying to participate in a distraction-free zone, which right now during COVID, that's hard. But the whole coaching process is virtual. So once they fill out that application, anyway, that application comes to me, I approve it, and then I connect with a coach on our team, depending on how much capacity each of the coaches have, and I'll assign that coach to reach out to that person, and then they set up a one-on-one call. Most people just are coached usually once a month, and it's an hour. And as I mentioned before, it's all virtual. We decided to go virtual before COVID, and that is something we'll probably keep after COVID because we wanted to reduce barriers for people participating, and virtually it's just the easiest way to make sure that process happens. So the coach sets up the time with that person, they meet for an hour, and then they schedule another time. And really anybody can request coaching as long as they want. There isn't a set amount of hours that we give to each contractor. It's really up to each individual. And then they can end coaching, maybe they've addressed a certain issue that they were concerned about, and they can start it up whenever they want. They just have to reach out to me. So that's a little bit about our structure.
Okay. And I assume when they fill out their application, do they have different topics on there? And is that how you pair them with an appropriate coach?
Correct. So sometimes, for instance, we have some coaches that have a lot of supervisory experience because they're, like I mentioned, we have some coaches that are executive directors of organizations. So if somebody is really struggling, maybe another supervisor is struggling with some workforce issues, employee issues, we may connect them to that specific coach that has more experience in that area. If they're struggling maybe with getting a coalition off the ground or getting coalition member engagement, we have two coaches that have had a lot of experience with drug-free community grantees or grants and work in coalition efforts. So we would engage those coaches for some of that work. A lot of times the topics are pretty broad. I'm struggling with work-life balance, for example. I'm having a really hard time fitting in my agency. Those are just some of the topics that tend to come up, and really all of our coaches could address any of those broader issues.
I love that the issues are so broad because we don't live in a vacuum in prevention, and there are other things that happen. So that's fabulous. If folks, because we do have folks that watch from all other states, if they have questions about this, could they reach out to you via email?
Absolutely. Yes. They can just contact me, or if they're interested in starting a coaching process through their organization, we can certainly work with them on that. We've created a lot of tools. We're actually doing some peer-to-peer work through our Overdose Data to Action grant and educating folks in jurisdictions around the country that want to set up a coaching system for themselves. So that's a part of the items that we're getting funded to do in that grant. So if anyone's just interested, they can certainly reach out to me. I'm happy to discuss further.
Okay, and I will put Julie's email address in the comments. So feel free to reach out with her. And thanks so much for joining me today. I really appreciate it. This is the very neat program.
Great. Thanks for your interest and your time.